Hello, and thank you for watching this short video about the COVID vaccination. There are a lot of questions about the safety and effectiveness of the vaccine, along with several other concerns many caregivers have expressed. Our goal is to answer as many of those as we can and help you make an educated and informed decision as to whether you intend to get vaccinated. Please keep in mind that as a frontline healthcare professional, you are in the same category as doctors, nurses, and therapists. Overwhelmingly, the majority of these highly trained and educated professionals not only felt the vaccine was safe, but also that it offered the protection and security they were looking for to enable them to continue performing their jobs helping people in need. Tam Scott is the Director of Nursing at Home to Stay Senior Care Solutions, and she is going to answer many of the questions we are hearing from caregivers and staff, just like you. We think you will find this very informative.
I know there are several vaccines available. Which one should I get?
That's a great question. All of the vaccines have been tested thoroughly and have similar results. The ultimate goal is to reduce the severity of the illness and the potential for hospitalization. And all of the vaccines have similar safety protocols and results. I think right now the priority for all healthcare providers is selecting a location that's close to you and getting the vaccine sooner so that you have immunity, which is safer for patients and providers.
If I've already had COVID, do I still need the vaccine?
I get that question a lot, and the answer is yes. Currently, there is no test for what's called neutralizing antibodies. The antibodies that you have are just general, so they don't speak to a specific immunity against the COVID virus. Even if you've had the COVID virus, you still can benefit from the vaccine in that it helps to build antibodies and T cells, which help to increase your immunity.
If I take the vaccine, does that mean I can roam around freely with no mask and do all the things I did pre-COVID?
No. Getting the vaccine does reduce your risk of getting the virus. However, there is still a chance that you can get minor cold symptoms and a runny nose that you could transmit to someone else, especially your patients. So until our infection rates go down, it is important that you still continue to wear your masks.
If I have allergies or on certain medications, can I still get the vaccine?
It's always important to check with your healthcare provider. However, to date, there haven't been any interactions with the vaccine and medications that we know of. It's especially important for people with comorbid conditions, such as COPD, diabetes, and who are overweight to get the vaccine.
If I have a suppressed immune system, is it safe to take this vaccine?
Based on our current data, yes. Since there is no live virus in the vaccine, it is safe for patients with immunosuppression. That includes patients with cancer and autoimmune disease. In fact, this is more of a reason that they should consider getting the vaccine. But as always, check with your healthcare provider.
What are some of the normal side effects, and how long can I expect them to last?
Great question. It's important that you know most people do get side effects from the vaccine, and it's normal. It's your immune system reacting to the vaccine. Side effects could include pain in the arm at the injection site, fever, chills, fatigue. Again, these symptoms are all normal and can last anywhere from 24 to 48 hours. Should you experience these symptoms, it's important that you take Tylenol and rest. These things can help greatly.
Is it safe for children?
Another great question. Actually, we do not know. In the U.S., we first do clinical trials on the adult population. Now that we've deemed it safe for adults, we will now transition to testing the vaccine on pregnant women and children.
How long after the vaccine do we know that we are protected? How long will the protection last?
So I'm asked this question a lot. It actually depends on which vaccine you get. most vaccines will require a second dose within 3 to 4 weeks of the initial dose. Full protection is achieved 1 week after the second dose of the vaccine. Currently, we do not know how long the vaccine will protect us, but it can range anywhere from 6 months for up to 2 years.
If I get the vaccine, is there a chance that I may not show symptoms and still be able to transmit the virus?
If you're getting the AstraZeneca or the Oxford vaccine, the answer is no. If you've gotten the Moderna or the Pfizer, the answer is we don't know. Those two vaccines have not been tested, so that's why it's important to always wear your mask.
How much will it cost?
Currently, there is no cost for the vaccine. It's paid for by the government. Typically, there is an admin fee that's covered by most insurances. For the uninsured, the state is working on a way to pay for the vaccine so that everyone can be immunized without an economical impact.
Thank you for all the information about the vaccine. I decided to get vaccinated and I'm okay. I'm back to work.
I'm still a little nervous, but I think the benefits outweigh the potential issues. I want to keep working and feel protected. I'll be getting vaccinated.
After learning more, I did get the vaccination. I felt a little sick for about a day, but then it went away. I'm glad I did it.
Here are a few other things to consider. If you plan to travel to visit family or friends, you may be required to have been vaccinated in order to do so. There is also talk that many facilities will not be letting caregivers enter their facility unless they have proof of a vaccination. If you do work in any facilities, you may be locked out if you are not vaccinated. Now that the vaccines are available, we are hearing from many new and current clients that they will only allow caregivers into their home who have been vaccinated. According to the Federal Centers for Disease Control and Prevention, several new variants of the COVID-19 virus are emerging from South Africa, Brazil, and the UK, and are already here in the United States. These variants spread more easily, and it's unknown whether the illness caused is more severe. It is believed that the current vaccines will still be effective even with these new variants. We hope this video has answered some of your questions and will be helpful in deciding if you feel the vaccine is right for you. Please contact your agency if you need help finding locations where the vaccine is being offered, or if you have any other questions.